we're having to adapt, and things could change tomorrow. They could, for the negative, they could be for the positive. So
we're starting a new series tonight that takes a look at how COVID-19 is impacting the family dynamic. Color 10's Madison Heaver talked with an agency about how the past several months have been for foster families, along with the challenges that the agency has been facing.
Like everyone else, foster care has been impacted by COVID-19, but that isn't stopping agencies from trying to reunite kids with their families.
the impact has been challenging. It threw us all into a big loop as far as what it's going to look like moving forward, because a lot of our job is hands-on, eyes-on, assessing safety, and it really initially put a pause on that.
Jeremy Elliott is a foster care case manager and supervisor for Presbyterian Children's Homes and Services. It's an agency that works to place children in foster homes and reunify them with their biological parents if possible. He says since COVID-19 started, they've successfully moved to virtual meetings, but were also met with reluctant foster parents.
They were a little reluctant at the time, just because of the concerns and a lot of the unknowns as far as how the virus was spreading and how, the changes in policy. So a lot of foster parents were resistant, and understandably so. But one of their biggest challenges, and we've run into this a few different times, is what do we do when a possible exposure happens? What do they do for their own family?
Because of the challenge of finding foster parents to take in a child,
sometimes we had to look outside the area. And for as much as we don't want to do that, because our goal is to reunify children with families, we don't want to place too far out because it makes reunification efforts a lot more difficult. In those instances where we did have to place children in outside areas, we were able to pull them back in.
He says some younger foster children were the ones impacted most by the virus.
We've got parents that are really involved, and we're having continuous visitation with their children. To go from having seated visits at the office and having those kind of parenting time visits to virtual like that, it did impact them a little bit. It was kind of mainly for the smaller children who didn't understand. Younger children, 5, 6, 7 years old, they have a harder time understanding and adjusting.
Elliott says even though they've run into some bumps along the way, operations are almost back to normal with some restrictions. Madison Heaver, Ozarks First.